everyone, welcome back to my YouTube channel. Today we are going to talk about Norma Lateralis. We will start our topic with introduction. Norma Lateralis refers to the lateral view of the human skull, providing an essential perspective for studying the side profile of the cranium and facial skeleton. This view is crucial in anatomy, forensic science, surgery, and radiology, as it allows an in-depth understanding of bone relationship, landmarks, and structure. Further talking about the introduction of Norma Lateralis, this side view of skull reveals key anatomical features important in medical studies and diagnostics. It includes bone that contribute to the cranial protection, jaw function, and facial expression. It is used in cranial imaging, neurosurgery, and forensic construction. Now let's talk about what are the bones visible in Norma Lateralis. Bones visible in Norma Lateralis include frontal bone, parietal bone, temporal bone, occipital bone, sphenoid bone, zygomatic bone, maxilla, and mandible. First bone we are going to talk about is frontal bone. There you can see in the diagram the green color bone is frontal bone, dark green color bone more specifically. It forms the forehead and superior orbital rim. It articulates with the parietal bone at the coronal suture. Now we will talk about the parietal bone, that is orange color bone in this diagram. It forms the upper lateral part of the skull and it is connected to the frontal, temporal, occipital and sphenoid bone. Now let's talk about the temporal bone, that is the purple bone in the diagram. It houses the external acoustic meatus, that is basically the ear canal. It includes mastoid process which serves as a muscle attachment site. It contains structures that are vital for hearing and balance. Next we will talk about the occipital bone, that is the pink bone in this diagram. It is located at the posterior part of skull and its features include the lambdoid suture that connects the occipital bone to the parietal bone. Next bone we are going to talk about is sphenoid bone that forms the part of the skull base and its lateral orbital wall. In this diagram we can see the red color bone is the sphenoid bone. It contains the greater wing that contributes to the cranial structure. Next bone we are going to talk about is zygomatic bone. In this diagram, the light green color bone is the zygomatic bone. It is also known as cheekbone and it contributes to the facial contour. It articulates with the maxilla, temporal and frontal bone. Next we will talk about the maxilla, that is skin color bone or golden brown color bone in this diagram. That forms part of the upper jaw and contributes to the orbital margin. It houses upper teeth and connects to the nasal structures. Next, we will talk about the mandible, and it is the only movable skull bone. It contains the condylar process that articulate with the temporal bone at the temporomandibular joint for jaw movement. Now, let's talk about the key anatomical features of Norma Lateralis. Key anatomical features. The key features of Norma Lateralis include temporal fossa, that is depression behind the orbit allowing muscle attachment. And other feature include is terion, that is junction where the frontal, temporal, parietal and sphenoid bone meet, and this part is vulnerable to fractures. Next feature is external acoustic meatus, that is opening leading to the middle ear. And next feature is mastoid process, that is bony prominence behind the ear, and it is important for muscle attachment. Next, we will talk about the clinical and surgical importance of Norma Lateralis. Importance include trauma analysis, as skull fracture can impact brain structures, and that's the reason it is important to understand the full structure of the skull to completely understand the trauma analysis or do the trauma analysis. Next importance is forensic identification, as it is used in skull profiling and reconstruction. Next is surgical access, as it is important in neurosurgery and cranial procedures. So this was all about Norma Lateralis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment.